What are pharmaceutical powders? Pharmaceutical powders are dry, finely divided solid substances which are containing one or more drugs, which may be used internally or externally. They are prepared by grinding and mixing the drugs to achieve the uniform particle size as well as the desired therapeutic effect. Hello everyone, welcome back to my channel Pharma Talk with Imran. In today's video, I am going to focus on a very interesting topic called as pharmaceutical powders. In this video, I am going to discuss what is the definition of pharmaceutical powder and what are the basic characteristics of pharmaceutical powder and how the powders are classified, what is the basic criteria for their classification. Now, what are the basic characteristics of pharmaceutical powders? The first one is they are dry in the form and they are free flowing, means they are having good flow properties. And second one is they should be stable and easy to handle and store. And the third point is they should have uniform particle size, which is very much necessary for the uniform and accurate dosage. Then they can be administered either internally or applied to the externally. Both they can use. Types of pharmaceutical powders or medicinal powders. There are various category of pharmaceutical powders like antifungal powders are there, which are used in fungal infection. And similarly dusting powders are there, then baby powders are there, and some astringent powders are there, some laxative powders are there which are used in case of constipation, and then antacid powders are there which are used in hyperacidity. Then ORS powders, that is oral rehydration salts, it is used in electrolyte replacement therapy, that is in case of diarrhea or vomiting there is a loss of electrolytes from the body in those cases. Now the classification of powders. So this classification is based on their use, whether they are going to use internally or they are used externally. Some powders which are used internally like bulk powders are there and divided powders are there. Example for this category is ORS, then talc, then external powders which are applied on the body surfaces like dusting powders are there, then insufflations are there which are used in nasal and ear root. Then some aerosol powders are there which are taken through by inhalation route by inhalation. Then other types like granules are there like effervescent granules, then dry granules for reconstitution. Now the classification of powders based on particle size. The based on particle size they are classified in three categories. One is coarse powder, another one is fine powder, then ultra fine powder. So here the particle size is 500 micrometers, and in the case of fine powder the particle size is 100 to 500 micrometers, and ultra fine it is less than 100 micrometers. Now what are the merits and demerits of powders, or you can say the advantages and disadvantages? Here the main advantage is it is very easy to swallow when it is incorporated in capsule. Then in the GAT there is a fast absorption. Because of fast absorption there is a faster onset of action. Then dosage flexibility is possible in case of powders, whereas in case of tablets it is not possible because the dose is fixed. They are unit dosage forms. We cannot flexible. We cannot make increase or decrease the dose. Here the dose is fixed. And the another advantage is they are more stable in nature because they are present in the dry form and they are present in the solid form. They are more stable as compared to other formulations. Then what are the demerits or disadvantages? So we need to mask the taste. If it is bad taste powder, then we need to add some sweetening agent or some other agents to mask the bad taste. If the powder is hygroscopic in nature, means it is going to absorb the moisture from the climate, then it is also difficult to formulate those powders in the form of tablets because there is a variation in the weight and that will affect the dosage. Then every time there is a need of dosage measurement. It is not like that simply we can easily take the tablet without any measurement because the dose is fixed. But here we need to measure the dose every time. Then uh, if the powder is hygroscopic or wet in nature, then it will affect the flow properties of the powder. Then definitely we cannot formulate the good quality tablets from by using those powders. So these are some advantages and disadvantages of powders. So there are another category of powders like simple and compound powders. So now what are simple powders? So here, according to the definition, simple pharmaceutical powders consist of only one API, means one pharmacologically active ingredient or substance. In short, it contains only one drug, and it also contains some non-reactive or inert excipients or diluents. They are added to improve the handling, to improve the taste, and to improve the stability of the formulation. Then simple powders are prepared by grinding method or trituration method or by pulverization to achieve the fine particle size, which is very much important, for the better absorption in the body and for dosage uniformity. So what are the different examples for simple powders? So here there are various examples like aspirin powder is there, which is used as analgesic and antipyretic. Similarly, paracetamol powder is there, which is used in case of fever, that is antipyretic. Then sulfur powder is there, which is used externally for many skin problems. Then zinc oxide powder is there, so which is also used for topical application in case of rashes. Then sodium bicarbonate is there, which is used as antacid in case of hyperacidity or for gastric relief. And the next one is compound powders. So compound powders are the pharmaceutical powders which are containing two or more than two medicinal substances. That is, they contain two or more APIs, that is active pharmaceutical ingredients. So example for this category is, there are various examples are there like oral powders which are taken by the mouth mixed with the liquid. Rapid absorption is there, for example amoxicillin. Then some powders which are used on the body surface, that is topical powders. They are applied to the skin and to treat the various infections and to prevent the moisture. Example clotrimazole, it is an antifungal drug. Then similarly there are inhalation powders are there, so which are inhaled into the lungs in for the bronchodilator purpose, to dilate the bronchioles in case of respiratory disorders. Then example is albuterol. Then similarly there are vaginal powders are there which are inserted into the vaginal area to treat the various infections in the vagina.